Hello, my name is Poolani Casey, and I'm here to talk about Let's Move, America's move to raise a healthier generation of kids. Today, we're going to help to cinch the belt on obesity and provide a healthy kids campaign. I want to talk about just the facts. 1 in 3 children in America are overweight or obese. 40% of African American and Hispanic communities are overweight or obese. A third of children born past the year 2000 will suffer from diabetes. And in a sample of overweight children ages 5 to 17, 60% had risk factors for cardiovascular disease, and 25% had 2 risk factors for cardiovascular disease. Some studies are showing obese children are not learning as well as healthy children. These numbers are staggering. It is clearly an epidemic, and it is the realization that something needs to be done. Let me tell you about Let's Move. It is an initiative for cities or counties to join in order to build healthy communities by providing resources, exercise encouragement and ideas, and access to healthy food. There are 5 pillars to Let's Move. 1 is creating a healthy start for children. The other is empowering parents and caregivers. 3 is providing healthy food in schools. 4 is improving access to health and healthy, affordable food. And 5 is increasing physical activity. Starting early includes encouraging the provider support and teaching for breastfeeding, encouraging healthy choices for young children by educating parents, such as serving healthy food and getting outside to move. We want to educate early child care providers and early education providers on healthy foods and physical activity. And we want to empower the parents and the caregivers by placing the My Plate display in the county or food service venues, providing healthy food or model food service, especially in schools, and improving access and affordability to healthier foods, especially in low-income families where fast food is affordable and fast and easy. And healthy food is a must in order to beat this epidemic. Serving foods at any local or county venue that is healthy is also improving access. On top of that, increasing physical activity, mapping play spaces, completing a needs assessment for more play spaces or developing better ones, and also developing an action plan, making a task force, or launching a minimum of 3 proven policies, programs, or initiatives increasing access to play. Remember, this is a commitment by the local or county branches in your area. It is not what is provided by Let's Move, but it certainly is a huge accomplishment by providing the health of your community. This status tells the people of your community that they are important and their children are our future. By creating a healthy community, you should give yourself a pat on the back. It's not easy, but it's worth it. Here's an example of the ChooseMyPlate.gov My Plate display. This is an easy way to look at nutrition. It is familiar to a place setting that you would have at any meal, and it shows an approximation of what foods should be in the diet in proportion. I want to focus on how much obesity costs. Research showed that being overweight increased pharmaceutical costs by 31%. If overweight or obese at 4 to 5 years of age, medical and pharmaceutical costs increase over the next 5 years. Medical costs were 10% higher, as well as 7% higher for other healthcare conditions for overweight or obese children. Another analysis showed pharmaceuticals were about 59% more and 50% more for other health conditions in overweight children. A longer duration of being overweight is suggestive of higher medical costs later in life. This research did prove what other research has suggested already, that being overweight or obese does incur higher medical costs. Being overweight or obese from age 5 and through the primary years is significant in healthcare costs, and proving that prevention could have a huge impact on the financial burden of government-funded healthcare or for providers and families. Costs can be higher for other healthcare conditions related to being overweight or obese, and costs can further increase with creating interventions for childhood obesity or being overweight. Bottom line, it costs less to prevent. It costs less for the country, individual communities, and families. Decreasing costs leaves room for spending on healthier food choices and ability to spend on physical activities, possibly organized sports programs, or gym memberships. But really, let's face it, you can get out and move anywhere. Why do I bring up costs? Because healthcare for chronic illness is significant throughout the lifespan. Knowing the amount of time a person is overweight or obese affects their medical costs. The longer the obesity, the greater the cost. Obesity is a modifiable risk factor. However, if not addressed, it can lead to other chronic conditions, not only increasing costs, but decreasing quality of life. It also costs to treat health issues. What if you could use that money to spend on other things your community needs, such as parks, or employ more park rangers to open closed regional parks? What if you can spend more on quality, healthier foods in schools? How about more money for subsidizing low-income families to purchase healthier foods for home-cooked meals, or subsidizing organized sports for low-income families? Decrease subsidized healthcare costs for overweight or obese children. Healthcare needs opens doors to help families be healthy or get healthy. How would you feel to look around and see happy, healthy kids playing at one of our new place-based parks? What a meaningful picture for our future. Why should you make this commitment? Healthier children and communities from birth and on, continuing throughout a lifespan, replacing fast food for healthy foods and creating a healthier community and environment. Bringing families closer together by encouraging eating home-cooked meals to the table and getting parents and kids moving. Increase self-esteem and learning in children and decrease stigma among children. Lower overall costs in your community for food, physical activity, and medical. You will play a huge role in many lives, and you will be rightfully recognized for the commitment and hard work. You will be proud of yourself and your community. This is just a few reasons why you should make the commitment. Can you think of any? This is an amazing opportunity for you to do something that can make huge changes in the lives of multiple families. Do you feel alone or like this is too much to commit to? Well, let's move on. Of course, no pun intended. How does the organization help you achieve your expected goals? Resources. They provide resources for ideas, strategies, and guides. Provides the Let's Move Faith and Communities Toolkit. Regular emails with a plethora of information. And introducing who is involved so you can collaborate with others in your community. Provides an abundance of information on eating healthy and getting active ideas. Plans Let's Move meetups, face-to-face conferences to discuss how you can help. Brings others in your community together to reach your goals. And remember, you are not alone. Your community will help.